Good evening, Dr. Rosenquist. This is my community nurse project on being a school nurse. Nursing within schools began in New York City, October 1st, 1902. The first school nurse was Lena Rogers. This is her picture to the right here. And she was hired to reduce absenteeism by intervening with students and their families regarding healthcare needs related to communicable diseases. A student's health is directly related to his or her ability to learn. If the student has multiple comorbidities and frequents the hospitals for minor treatments, this takes away from the learning experience of that student. Scope of practice. Nurses within schools provide leadership, community, public health, care coordination, and quality of improvement. They also manage the implementation of school health services programs, and they serve as a pivotal role that bridge health care and education. Primary roles of nurses within school systems. They provide health care through assessment, intervention, and follow-up for all children within the school setting. They also address the physical, mental, emotional, and social health needs of students and support their achievements in the learning process. Without this type of support, students tend to drop in grades and concentration. School nurses are members of two divergent communities, educational and medical nursing, and as such are able to communicate fluently and actively collaborate with practitioners from both fields. Chronically ill students coming to school in increasing numbers with increasing complex medical problems require complicated treatments. Asthma, anaphylaxis, diabetes, epilepsy, obesity, and mental health concerns may affect the student's ability and readiness to learn. School nurses lead in the development of policies, programs, and procedures for the provision of school heal services at an individual and district level, relying on student-centered, evidence-based practice and performance data to inform care. Some teaching and learning strategies. Healthcare education. They help with the latest research study, educating patients and families and other members of staff. Treatment options and recommendations and infection control within the facility that they're working in. They also help with counseling. They have counselors available for physical and emotional support of the child, and they also help with stress relief and coping skills. So if a child ever goes through a traumatic injury or something that happens at home that wouldn't be conducive to a learning environment, the nurse can refer or help with coping skills for that child. As an advocate for the individual student, the nurse provides skills and education that encourage self-empowerment, problem-solving, effective communication, and collaboration with others. Some other teaching and learning strategies. They also give nutritional recommendations, so they are big supporters of the diet recommendations as opposed to chemical treatments. One of the main examples of this would be ADHD. Many of the nurses and healthcare professionals like to start, especially pediatric populations, out with diet changes as opposed to prescribing Adderall. And then physical education as well, which help with weight loss and increased focus in the classroom. Nutritional, they also maintain the school lunch program as well and have major influences on what is served to the students. And physical education, they can also help get parents involved with neighborhood sports or public functions. Educational preparations, so basically the requirements that you might need or see with one that's working in the public school setting. Generally, they're LPNs, RNs, BSNs. They all qualify within the school setting, just at different levels. The gold standard for a nurse within a school is a 4-year BSN with previous clinical setting experience. School nurses may come into contact with the following professions: social services, Department of Children and Families, other physicians, including the student's private physicians, counselors, and they would come in contact with local EMS, police, and other area hospitals depending on what kind of a situation that they're dealing with. For example, if a student gets injured really badly on the playground, they would have to be able to know how to talk to EMS to let them know what the situation was so that they can get the proper care. Counselors, a great example would be if the student were to be abused or bullied, they would be able to refer that student to maybe outpatient care or a counselor within the school for daily treatments. And then they also speak with the students' physicians quite frequently, especially if they have several comorbidities or if they're special needs. Necessary skills and abilities. Communication is key between students, family, and staff. Being able to have the ability to explore sensitive topics at the appropriate age levels. For example, this would be sexual conversations. You wouldn't have the same type of conversation with an 8-year-old as you would with an 18-year-old. The same with abuse situations. You want to keep everything age appropriate and mention things at different times depending on the age and maturity of the child. You also want to protect patient rights and involve the family when appropriate. So under 18, parents and DCF would probably get involved if it were considered a major event or if the student were to need to be admitted to the hospital for a serious injury. Necessary skills and abilities. Nurses really need to know how to stay calm during stressful situations, especially working at a school. When dealing with children, the more stressed you are, they really pick up on that negative influence and tend to either shut down, not talk to you, or they will just break down and cry altogether. Having the ability to critical think through any situation that may arise is another great skill that you're going to want to have, and organization as well. Without critical thinking and organization, nursing probably wouldn't be as effective as it is today. Unique facts that I learned: teachers develop learning plans and then nurses develop healthcare plans. So basically the same thing goes for the teachers as for the students. So whenever you have a student in the school setting that requires treatments, albuterol, special medications at certain times, or their special needs and require oxygen or anything like that, you would have a specific folder or healthcare plan based on that child so that they can get the proper care. Same as teachers. Teachers develop specific learning plans based on the child's needs at that time. Consultation with physicians in response to special needs students or complex medical situations. And this is my reference page. I referenced quite a bit of things, including the American Nurse Association and the Center of Disease Control. That concludes this presentation. I hope you have a wonderful night.